Sometimes, in a long-term care setting, you'll see a resident who's behaving poorly, distressed and distressing others, trying to escape, perhaps even threatening others. It might seem like common sense to restrain people like that, but most of the time, you can't. Why not? Hi, my name's Keith Manning. I'm a licensed healthcare administrator and an ordained minister. I'm interested in helping you care for the whole person. When you picture restraining someone in a clinical setting, you might think of a straitjacket, and that is one type, but there are many more. Restraints fall into two categories, physical and chemical. Both are intended to restrict movement. A physical restraint is a thing, such as a barrier. Chemical restraints include sedatives, opioids, anti-anxiety drugs, even antihistamines, which are available over the counter. I cannot tell you the number of times family members have requested, even demanded, that we restrain their loved one in long-term care facilities that I have run. They know from experience that hospitals can employ physical and chemical restraints, and they wonder why skilled nursing facilities, rehab facilities, and nursing homes cannot. Partly, the answer is because hospitals are governed by one set of regulatory agencies and long-term care facilities are governed by different ones. Long-term care facilities routinely utilized restraints under the belief that it was in the resident's best interest in many cases, but there were abuses of restraints, often for the convenience of the staff rather than for the well-being of the residents. The Nursing Home Reform Act of 1987 ended all of that. Yes, it's been well over 3 decades since things changed, but few of the general public are aware of this change. Any type of restraint can lead to serious physical and emotional consequences. This has included strangulation, increased falls, increased anxiety, depression, social isolation and emotional withdrawal, feeling humiliated, increased muscle wasting, pressure ulcers, decreased cardiovascular health, and on and on. Many times, people want rails on the beds and are unhappy when told that is not possible. They want us to prevent their loved one from falling. They want us to quiet an unruly and screaming resident, and they don't understand why we can't just medicate them. There are several possible reasons why a restraint might seem called for, but it's simply not possible. Are restraints ever allowed in long-term care settings? Yes, but only under limited circumstances and with strict stipulations. A restraint must be deemed medically necessary to treat a specific disease or condition, such as immobilizing a body part so that it can heal. Restraints can be used if a resident becomes a danger to himself or others, but even then, it's only by doctor's orders for a limited time, no more than 2 hours. The resident has to be under observation while restrained, and the restraint must be discontinued as soon as possible. There are alternatives to restraints, and those can and should be employed. These may include redirection, providing exercise, eliminating distracting or triggering stimuli, lowering beds to the floor and using fall mats, anticipating physical or emotional needs and meeting those needs before the resident becomes distressed. And most importantly, recruiting the family to help keep the resident as calm and content as possible. We have more content about improving quality care for our elders. If you find this helpful, follow for more.